what's next in front of us now may seem almost overwhelming. I thought I would try and put together 4 observations that will put in context what we've been talking about. The first is the irony. We've been having increasing globalization for quite a number of years. The major industrial countries all have their economies intertwined, and at some level we all knew there was a likelihood that someday we might have a pandemic. Maybe not so much like the folks at Johns Hopkins, but I think your point is well taken. But what stands out to me is I don't think many of us, not me, anticipated the degree of dislocation in healthcare and health policy, the degree of changing our way of social activity, the destruction of the economy, with now millions and 10 millions of people suddenly unemployed, many of them uninsured, some of them unable to sustain their life without food handouts. That's an enormous change. It is, as Michelle said at the beginning, a change we're not going to, and Harvey said it too, we're not going back anymore. It's going to be really different going forward. Second point I want to make is this has been a really interesting time for the medical healthcare system. It is both their final hour and where their soft underbelly of concern is evident. Every morning, physicians, nurses, thousands, tens of thousands of hospital staff go to work for 8, 10, 12-hour shifts where they care for patients with COVID-19. And they've been doing it, miraculously enough, often without masks, without gowns, without gloves. Nothing less than totally heroic. And unfortunately, many people have paid the price. At the same time, there are challenges. While we're seeing heroic action in American medicine, there are challenges that are fanning the flames, which you call the structural difficulties. We have a 2-class healthcare system a lot of the time, and certainly the disadvantaged populations here, the indigent, minorities, blacks, Hispanics, have really gotten hit hard indeed. I want to build up on another theme. Harvey talked about the pluralism of decision makers, and I think it's important across all sectors. I want to emphasize how fragmented and pluralistic our country is, with 50 states, and even in those states, enclaves, and each with a different cultural background, different ethnicity, different volume, all quite different. And in those differences, asking the question, where do we go from here? We're not going one place from here. We're going to go multiple places, reflecting those different divisions, the different states, the different patient groups, the different ages of the different patients, and the different stages that we have in the epidemic. Finally, let me say that I think this is going to be a long haul, really long. You know, they say euphemistically, if we're lucky, we'll have a vaccine in 15 or 18 months. What happens if we're not lucky? There is no tried and true playbook here. The euphemism or the metaphor that you were referring to was we're stuck flying the plane and building it at the same time. Well, that is exactly right here. And worse than that, there's no air traffic controller to give us guidance out there. Ready or not, I think we're going to have a massive natural experiment that will be prolonged and fueled by decisions coming out of states, multiple municipalities, and then all the different sectors that Harvey alluded to. I'm hopeful with that monitoring, with monitoring and study, we'll get to a good place. The one part I'm pretty sure of is that our chance to be successful will be higher if we put together the voices from medical science and clinical medicine and immunology and epidemiology and public health policy all together, much as we have today.